Good evening all, I'm Aditi Lamba with the Wednesday night edition of South Asian News. Welcome to Vision of Asia, voice of our community. We are coming to you from our studio in New York City. Here is what is happening in the coronavirus pandemic. Globally, the coronavirus cases have surpassed a sobering number of 20.3 million with at least 741,000 deaths. In the United States, we are looking at nearly 5.2 million cases of COVID-19 and more than 164,000 deaths. The nation is by far the worst affected country in the world. Coronavirus continues to spread at high rates across the U.S. South, Midwest, and West. The U.S. is averaging about 53,000 new cases of COVID-19 per day and 1,000 deaths each day. This is happening while the nation is grappling with schools reopening in a safe manner, along with college football conferences as well, posting the lucrative fall season with the continuation of economic and health ramifications impacting communities all across. 63 out of 101 largest school districts in the country are starting the new academic year remotely. During this time period, health experts cannot stress enough the importance of social distancing, avoiding large gatherings, hand washing, and most importantly, wearing a mask to contain the spread of this virus. So if you are in areas surging with cases, please follow the guidelines of the CDC, protect yourselves and others around you. If you are a South Asian parent or an educator, please reach us with your opinion on schools reopening on events at itvgold.com. Also calling on all medical professionals to connect with us on their frontline experience and advice for our audience. In politics, former Vice President Joe Biden, the presumptive Democratic nominee's pick of Senator Kamala Harris as his running mate has sparked delight and much enthusiasm in the South Asian community by becoming the first Black and South Asian American woman on a major party ticket, a daughter of two immigrants from India and Jamaica. We surely look forward to seeing the South Asian representation at the presidential elections in November. Former Vice President Joe Biden and Senator Kamala Harris both delivered remarks today from their first campaign event in Delaware. The former Vice President called Senator Harris the right person for the role of Vice President and said that the country needs a president and a Vice President willing to lead and take responsibility, and that Senator Kamala is America's story as a child of immigrants. With that, let's begin tonight's episode discussing much on the coronavirus pandemic. Here are the headlines. Dr. Purvi Parikh addresses coronavirus updates and vaccine trials in New York City. Dr. Tushar Patel on surging COVID-19 cases and schools reopening New Jersey. Science journalist and author Sonia Shah discusses health and social impact of COVID-19, Baltimore. It's time for a short break. Stay with us on Vision of Asia, Voice of the Community. We'll be back shortly. Welcome back. I'm Aditi Lamba and this is Vision of Asia, Wednesday night episode of South Asian News. We are looking at the coronavirus impact and measures and its developments. Researchers in the US and across the world are working tirelessly in developing vaccines for COVID-19. According to the World Health Organization, there are about 167 potential COVID-19 vaccines being developed across the globe. Amongst the major potential vaccine is Moderna, in collaboration with the National Institute of Allergy and Infectious Disease, part of the NIH. The U.S. government has reached a $1.525 billion deal with Moderna to provide and deliver 100 million doses. It is one of the several companies such as Pfizer, Johnson & Johnson, to manufacture the vaccine at risk, meaning the company is making the vaccine before it's approved. And on vaccine, Russia is saying that its unproven vaccines could be available to other countries, but medical experts worry that there isn't enough data to back up its safety and effectiveness. Earlier today, we spoke with Dr. Purvi Parikh, who provided much insight into these vaccine trials, along with her take on surging cases in the nation. Here is Dr. Purvi Parikh. Are we currently safe with COVID-19 in the state of New York or in the state of New Jersey or the tri-state area? What is your personal take on it?
Right. So, we still don't have a vaccine ready for everybody or an extremely reliable treatment. So I wouldn't use the word safe, but the good news is the cases are down. And I think that's a result of us being very, very careful. So it's not a good idea to stop being careful. The city luckily has kept the cases low. But the problem is, I know at least a few weeks ago in New Jersey, the cases already started climbing up a lot because of indoor events, indoor parties. So we still have to be very careful because the virus isn't gone. We just have gotten ahead of it.
Let's get into talking about the states that are surging with cases right now. I'm looking at California, Florida, Texas. They have all surpassed the number of cases we saw in New York. And the South, Midwest, and West are currently filled with cases. Do you think this spike is the reason of reopening too fast, or just an increased testing?
No, I think it definitely is reopening too fast because the rate of the cases are far exceeding the rate of new tests. So if both were increasing at the same time, I'd say, okay, maybe it's the testing, but it's not the case. There's definitely more cases than tests being done in terms of frequency and volume. The other thing is a lot of the states open before the curve was going downward. A flat curve does not mean zero cases. It just means that the cases are continuous and not going up. You want a downward sloping curve before you can even consider a reopening. So downward means it's going to zero. So New York followed that. They waited 14 days for cases to decrease, deaths to decrease, hospitals to open up before they even thought about opening up. But a lot of other states didn't do that.
Just talking a little bit more into the vaccine, I know you have been very involved in the entire process of these vaccine trials. I wanted to know what kind of information you could share with us at this point on ITV Gold. We're hearing so much on this race for vaccine between countries, between different pharmaceutical companies. What is going to create an effective vaccine that is, workable next year?
Right. So the good news is multiple companies have shown in their initial phases that the vaccine is effective. It's also safe, but we don't know how long that immunity will last. So we know it works, at least now in the short term, and we'll be following those patients to see how long it lasts. And now many of those companies have moved to phase 3, which is the last step before FDA approval. And that's when they'll test 30,000 people minimum, just to make sure it is safe, it is effective, and test all different groups, high-risk groups as well. So hopefully, we continue to get good news and it works at the large scale too. But the key will be how long it will work for.
And how long do you think it'll take them to determine that? And
we're hoping by the end of the year. This development is happening at a much faster rate than ever seen before. Normally, a vaccine takes at least a couple years, and that's on the optimistic side to develop. This is the first time we're moving this fast from phase 1 to 2 to 3. But the good news is, since so many companies are involved, if we have multiple effective vaccines, that'll be great because then there will be more supply for everybody.
In terms of looking at these pharmaceutical companies, could you give us an insight into how many companies are involved or which are the main ones that are currently involved in these vaccine trials?
Yeah, so I don't know the exact number, but I believe there's at least 10, probably more, of companies around the world working on vaccines. At least here in the US, both Moderna as well as Pfizer has moved into their phase 3 testing, which is the last step before the FDA approval. It's anticipated that AstraZeneca may soon follow because they're already doing phase 3 in other countries. So hopefully that will be coming soon. But, they each have different technologies. So both Pfizer and Moderna are both mRNA vaccines. And then Oxford is a little bit different. It's an adenovector virus. So what that means is each of these have different ways of creating that immunity in the body. Yeah. And then, as you may have heard, Russia recently announced they have a vaccine, but there's a concern if they did all the phases appropriately.
Getting students back into the classrooms during a pandemic has now become one of the most debated topics of reopening, with thousands of parents left to make a decision on whether or not to send their child back to school. In several schools where in-person learning is resumed, there are reports coming of new coronavirus cases among students and staff. 63 out of 101 largest school districts in the country are starting the new academic year remotely. In Georgia, the Cherokee County School District today announced that it would temporarily close in-person learning due to COVID-19 cases. Here in New York and our neighboring state, New Jersey, both governors are now allowing schools and universities to reopen, with school districts to spell out a plan for reopening with all safety measures. But what is the medical opinion on sending kids back to school during the pandemic, and what do the parents and educators truly need to know? We spoke with health expert Dr. Tushar Patel on this and coronavirus update. Here's what he had to say about schools reopening safely. The number of deaths that are happening right now in these states that are surging, because in comparison to New York, California still has a lot less in the death number. Even in comparison to New Jersey, California has less death numbers, but the cases are larger. How do we understand that?
So last 6 months, we have learned a lot of things about COVID-19 infection rate, the how to manage the disease itself. I think the public health officials now have some hold of understanding how should we treat disease, how should we admit the patient, when should we admit the patient, when do we put them on ventilator. And all those things are much better for the public health officials, the institutions, the hospitals, and our medical providers. So I think that is one good thing that is helping other states where they have situations like New York and New Jersey, but we don't see too many deaths right now because of those. And one other thing is very interesting. Lately, in last month or so, the young individuals also getting infected in a higher number. So the young individuals do have a good immune system, so the death rate in young individuals is lower, and that is the whole reason we don't see the higher number of deaths in those states.
Just yesterday, about 100,000 children have been, sick due to COVID-19, and young Americans, as you just said a little bit ago, are increasing in number of cases. What is going to be the long-term effect of that? And do we need to now start being really concerned about these young Americans?
So the young Americans, the school-age children, the college-age children, they thought that they are immune, their chances of getting infection is very low. That is not true anymore. So I think we should be thinking or rethinking of opening the schools, opening the campuses, opening the colleges, because I think that will create a tremendous pressure on the public health in the hospital settings, and we may see a lot of complications from the young individuals. So my personal feeling is we should rethink of reopening the schools in September, the colleges, campuses, and I think we should have a approach some common sense approach where we can have a good outcome in this outbreak.
What is needed from our government, all levels, local, state, federal? What is needed to be done in order to contain this?
I think the clear message needs to come from the public health officials, including CDC and WHO and all other public health organizations, that the virus is still going on. Pandemic has not been called off yet. Pandemic is still on. We should be taking all the measures to control by using the facial coverings, the mask, covering your cough and sneeze. If you have a fever, report to your doctor immediately. Isolate yourself, quarantine yourself. Use the common sense approach. Don't do anything in public. There is no reason to do any parties right now. We can hold off all the gatherings if possible right now. And I think if we can do that, if people understand that this is controllable, we can definitely control that. And we have a proof that New York and New Jersey from 53% to 1%. All the states can do the same if we can have those mitigating factors and common sense approach on the disease.
Do you believe in a mask mandate, like a universal mask mandate that many health officials are talking about?
If you are in the public places, you must have a facial coverings because that is proven to have definitely impacted on the mitigating factor to reduce the spread. So if you are in the public places, if you are at the park, if you are at the beach, if you are at the restaurant, you must have facial coverings. If you are at the grocery store, you must have facial coverings. That is proven to be one of the biggest factors to control the spread of the virus, which we have seen in New York and New Jersey.
The vaccine we're hearing from Russia, the news was declared today. Any comments on that?
So Russia came same with when we had the outbreak of Ebola, and unfortunately that did not work well. So I have mixed feelings about that. And I don't have trust on any other country for the vaccination except the United States, where we have a strict control measures, efficacy, safety, and ensure that the vaccine is safe to given to all people in this country. So let's wait. I would not give credit to anyone at this point until we hear from our experts in FDA that we have, or NIH, that we have a vaccine which is effective and which can save lives when we have it end of this year or early next year.
Do you think they have come out with this vaccine way too early?
I think so, because like I said before, it takes about 4 to 6 years for the vaccine. So if you don't have those clinical trials, phase 1, phase 2, phase 3, and in phase 3 you need to have enrolled thousands and thousands of people to ensure that each and every one received the vaccine, waited for 14 days, 20 days, 3 weeks, to ensure that its efficacy is good, 60-70%, and the safety is the most important factor, because you don't want to get complications from the vaccine. So it could be definitely an issue if we have those kind of vaccines available right now.
It's time for the short break on Vision of Asia, Voice of the Community. We'll be back shortly. And welcome back. This is Vision of Asia, the South Asian news segment, and I am Aditi Lamba. We are looking at the coronavirus pandemic's impact, measures, and updates, featuring top health experts and officials to bring forth relevant and credible information. We have now a segment featuring Sonia Shah, an investigative science journalist and author of critically acclaimed prize-winning books on science, human rights, and international politics. Sonia Shah's writing has appeared on platforms such as the New York Times, the Wall Street Journal, Scientific American, and many more, and has a lifelong interest in exploring inequality between and within our societies and the impact of science on prevalent happenings such as the pandemic. We spoke with Sonia Shah discussing much on her ongoing research on the health and economic ramifications of COVID-19 on the society and the prevalence of racial disparities seen throughout this pandemic. Highlighting the importance of social distancing, Sonia Shah called for a combination of strategies from both health experts and the government to help the healthcare crisis in the nation. Here is Sonia Shah. Why are we not able to contain this virus almost 6 months into the pandemic, at least in the United States? In China, it started a lot earlier. What is so different about, COVID-19 that just is unable to contain it?
We have this expectation that we should be able to contain it quickly, but if you think about the spread of infectious diseases around the world, we still have malaria, we still have tuberculosis, we still have cholera, we still have a lot of diseases, HIV, that's a pandemic that's going on right now. Cholera is a pandemic that's going on right now. We still have hundreds of millions of people who get sick with diarrheal diseases and other contagions. So just the fact that we know how to control a contagious disease doesn't mean that we're able to do it. So respiratory pathogens are particularly difficult. This is something that, is exploiting a human behavior that we can't easily avoid. We do get together. We have social interactions. That's really key to a lot of our commerce, our education, our society's well-being. So it's a difficult problem to begin with. But on top of that, we have the political response that I think has been very dysfunctional in this pandemic. So we could have done a lot better here in the United States in particular and in other countries. But there was, the other part, the spread of the pathogen is only half the story. The other half of the story is how we respond. And this pandemic is calling upon a huge amount of human cooperation across borders, across populations. And that's something that's a huge challenge for us right now.
Today, we heard that Russia is trying to announce the first COVID-19 vaccine. What are your comments on that?
There's a lot of faith going into vaccines, a lot of hopes and expectations. And, what is more likely is we're not going to have a vaccine like, the polio vaccine or the smallpox vaccine or the measles vaccine. Those are highly effective vaccines that, they give 90% or more protection to the people who get them. Best case scenario, I think, probably with this particular pathogen is maybe we get a vaccine that's 50, 60, 70% effective, maybe more like a flu vaccine. So it'll be one tool that we'll be able to use, but it's not going to be sort of the single thing, the magic bullet that's going to make this thing go away. We're going to have to use a variety of different strategies to contain this particular pathogen. A combination of behavior changes and better, slightly better treatments, which we're already starting to see, and hopefully at some point in the future a vaccine. But we're going to need all of it, because I don't think there's any realistic scenario in which we have a 95% or 100% effective vaccine within the time frame that this first wave will pass through human populations.
You have openly been talking about disparity and inequality during this pandemic. Could you briefly reflect upon that?
Well, almost all contagious diseases fall heaviest on people who are poor and marginalized, whether it's because they're, don't have access to health care, or they don't have good shelter, they don't have access to good, running water, clean, safe food, safe working conditions, all of those things. And we're seeing this pathogen, like all the pathogens that have come before it, taking advantage of those, the inequalities that run through our society. So I think probably the more striking aspect of this particular disease is that it's not just poor people and marginalized people who are getting it. It's also wealthy people and also people with privilege who are getting it. In fact, that's probably the most unusual part of it, because most other contagious diseases really preferentially affect the poor and the marginalized. You think about a disease like malaria, which we've known how to cure and to prevent for hundreds of years, and we still have hundreds of thousands of people who get sick, and many tens of thousands of babies who die of malaria every year despite that knowledge.
What are some of your biggest fears or concerns right now, 6 months, again, into the pandemic?
We're losing a lot in terms of small businesses and whether those are going to come back. And then our young people who are, you don't get those years back. And those are critical years. And I think about, say, the climate crisis, which is such a huge thing that's going to be a huge challenge that we have to face. And we need our young people to really be good stewards of nature. And yet what we're telling them is to stay indoors all the time and look at screens. And I just don't see how, I know a lot of biologists and environmentalists and leaders in that field. They're inspired to do it as children when they interact with nature. And we are kind of sending a whole generation of children inside where they can't do that. And that does worry me.
Yeah. The public that's watching this right now, if they really want to know how to truly protect themselves, what do we do besides social distancing, besides washing hands, and besides wearing a mask? What else can the public do, according to you?
Well, I think we need good governance. So we need to do all those things. We need to, take all the public health measures that we know about that do work. Washing your hands, wearing masks, social distancing, avoiding crowds, all of those things. We need to do all of those things for sure. And we need to educate our friends and families and neighbors that they should do it too and make a point of it. Be a model for all those good behaviors that we want. But more than anything, we need good governance. So we need to be involved in the political process so that we do get the good governance that we really need to get out of this thing. Hopefully by the time we have the next election, there'll be many more people who will be able to be involved in the process. I mean, less than half of Americans vote, right? That is a huge problem. So we have to fix our civic health in order to get to good public health. I'm hopeful that in the next few months, we're going to see more and more people actually taking it upon themselves to make sure they vote, make sure they're registered, make sure their friends and families are going to go out and vote.
And this is all for tonight's show. Remember to send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on Facebook @itvgold. You can also subscribe to our YouTube channel to watch many of our popular shows for free. Thank you for joining us tonight from Queens, New York. This is Vision of Asia, and I am Diti Lamba. Take care and be well.